Hi, I'm Dick Lemen. I'm a member of the Science Advisory Board. And as Dr. Frank said, epidemiology is oftentimes the facts without the tears, as Dr. Selikoff described it. But for this epidemiologist that has been studying asbestos since 1970, almost 47 years, I shed lots of tears over the victims of asbestos-related disease because I know what the suffering is. And so I'm going to give you some of the later statistics. Linda said that CDC just came out with the new information concerning asbestos. I would say it was the NIOSH CDC data that brought this about. And we do see an increase in asbestos-related disease, particularly in the older generation. Why is this? Because of the long latency period that it takes from initial exposure. But we're also seeing new trends, which, how do you advance this? Yeah. Okay. We're also seeing some new trends that there are about 1.3 million workers still exposed to asbestos in the United States today. About 3,200 diagnosed mesothelioma cases a year. Most of these a lot of these are in males as compared to females, and I'll talk about that in a little bit more detail in a minute. There are 2,597 deaths reported in 2015 from mesothelioma, and there are about 12 to 15,000 asbestos-related disease deaths in the United States per year. The anatomic sites for mesothelioma are principally pleural in males, a little bit less in females who tend to have more peritoneal mesothelioma. Less than 10% of mesotheliomas occur in the highest exposed workers. Why is this? Well, we have to look at other factors besides asbestos, but asbestos is certainly what triggers it. We're concerned about genetic susceptibility, and this is where a lot of research is continuing today. And this is similar to most occupational carcinogens. It's not just to mesothelioma, but also to other carcinogens found in the environment. The average latency, as many of you know, is 30 to 40 years. And it wasn't until the late 1990s that the first international classification of disease code was even recognizing mesothelioma as a distinct disease. So this has made the counting and the understanding of epidemiology for mesothelioma quite difficult because we haven't been able to really pinpoint mesothelioma as a distinct disease. We had to look at other international codes to determine mesothelioma. The overall rates are about one per 100,000 in males. It's a little bit higher, almost 2 per 100,000 females, about 41, less than 0.5 per 100,000. It seems to occur highest in white males, with black males about half that, and the next highest category. And the highest rates we see in the 75-year age bracket and older. If we look at what the CDC and NIOSH came out with this year, this just is a slide that shows a little bit of the patterns of mesothelioma. I'm not going to spend much time on this. You'll see it in the presentations. In the world, we have about 125 million workers exposed to asbestos. 50,000 plus mesotheliomas per year. This is drastically up from 1990, and I think this is an underestimate, and because of our various surveillance systems not being very accurate. 194,000 deaths per year alone from asbestos-related disease are counted around the world, and asbestos-related disease count for 2/3 of the burden of all occupational carcinogens in the world today. 3.4 million disability-adjusted life years lost, which is very much up and it continues to grow in our statistical pattern of mesothelioma since 1990 when we really started counting this. Men and women's risk to mesothelioma, people say that women are not as susceptible to mesothelioma as men. That's a bunch of bunk, because if I looked at cohorts of occupational exposure, when you have similar exposures in the occupation, the rates are almost identical between men and women. And so this is because oftentimes women are just not counted in the statistics for mesothelioma. And we need to understand that women are just as susceptible to an asbestos-induced mesothelioma as are men. Pleural is highest in men, but peritoneal, as I said earlier, is highest in women. And the incident rate of mesothelioma usually falls after 45 years of latency for pleural, but that's not true for the peritoneal mesothelioma, which continues to rise as the latency period lengthens. We have better associated survival in females for peritoneal mesothelioma, for those that receive site-directed surgeries, and those that receive radiation. The increase in mesothelioma among women, I quote from Julian Pito, a researcher in England, is probably due to a lot of ambient exposure and environmental exposure that haven't really been recognized in the past as causing mesothelioma. But as the statistics and the epidemiology grows, we're learning more and more about the risk in women. So I want to point out again that the risk in women is one area that we really see rising in our statistical evaluation. So if you look at those under 40 years of age, it's a very rare cancer as compared to those over 40. The ratio in under 40 years of age is almost identical for male and female, but when you look at the greater than 40, it's obviously much higher in males than women. A lot of this is because males make up the workforce in the past where the higher exposures to asbestos have occurred. It's less likely occupational in those under age 40, and 49% between the age of 35 and 40 is where we see most of the mesotheliomas occurring today in the younger population. 84% are white in this younger population, whereas 92% are white in the greater than 40-year population. 47 to 48% are pleural versus peritoneal in the under 40 category, but if you look at the over 40 category, the majority of mesotheliomas are occurring in the pleural area as compared to the peritoneal area. It's usually a longer latency or a shorter latency for the under 40, but the survival is usually longer in the under 40 group as compared to the over 40 group, when the survival is usually 6 to 8 months. And the 5-year survival is also greater in the under 40-year age group with mesotheliomas compared to the over 40-year age group. And just quickly, a lot of the litigation going on is trying to point out that chrysotile is less hazardous than the amphiboles. That's really a fallacy, because the chrysotile leaves the lung and migrates to other parts of our body, and we find the chrysotile in these other organ systems, and particularly in the pleural area where mesothelioma develops for pleural mesothelioma. And we want to use higher powered microscopes to look at this. So 30 seconds later, I'll say there's no safe concentration, and that what we need to do, as we proposed at NIOSH in 1976, we need to ban asbestos in this country. And lastly, I want to say as an epilogue that we need to look at other elongated mineral fibers. It may not just be asbestos, but others that have the same characteristics of asbestos may certainly give us future problems. So thank you very much. My time's up. Bye-bye.